Hi, my name is Dr. Peter Lee here at Wave Plastic Surgery. And today I want to talk about a real sort of revolutionary medication that really helps us fight weight loss in patients. And that is tirzepatide or Mounjaro. This is one of the newer medications for actually diabetes, what we call GLP-1 agonist or glucagon-like insulinotropic polypeptide agonist. Previously, there has been other medications that kind of work the same way, such as Wegovy and Saxenda. However, this is the first medication that actually works at another receptor called GIP. And we think that works synergistically to help patients lose weight by, number one, losing appetite. They don't feel like eating. And it works in the gastrointestinal area to cause early satiety, that is, the feeling of fullness after eating even just a little bit. And the food doesn't move particularly fast in the GI tract. It stays in there so you keep on feeling full. Patients don't feel like eating. They don't really have a sense of hunger. And even if they eat a couple of bites, you feel full. And by working in this way, it clearly has demonstrated both in terms of consistency as well as the amount of weight loss that it works better than any other medication that has so far been developed. The way that we know this is that last year, July of 22, in the New England Journal of Medicine, where they took over 2,000 patients, divided them into 4 categories, where one category, placebo, the second had 5 milligrams, the third, 10 milligrams, and the fourth had 15 milligrams. And they did all of this with change in lifestyle as well, where they kind of adhere to a certain diet as well as exercise. And what they noticed, in the group of placebo, there was about 3% weight loss. And that's what you would expect with change in lifestyle. With 5 milligrams, they noticed 15% weight loss. With 10 milligrams, they noticed 20%. And with 15 milligrams, it kind of plateaus off, so about 21%. And based on this, it really blows away the efficacy of other medications previous to this. For example, like phentermine, okay, which is a common oral medication that people take to help lose weight. It's about 5% weight loss. With Saxenda, which is kind of the first line of GLP-1 agonist, which you had to inject on a daily basis, that resulted in about 8% weight loss. Then in 21, Wegovy came into the market, and that resulted in about 15% weight loss, which you had to inject on a weekly basis. And now with tirzepatide or Mounjaro, that in a therapeutic range, which is around 7.5 to 10 milligrams, you can expect to lose about 20%. And this is also a weekly injection medication. We have actually seen some patients who's not really obese, who just had that extra 10 pounds that they actually want to lose. And it has really worked for them as well. In terms of side effect and tolerance, okay, for a lot of people, it's usually just gastrointestinal side effects, such as nausea, diarrhea, and constipation. In some patients, they feel a little bit weak, and you would expect that, obviously, with decrease in food intake. And some people, they feel they have a little bit of musculoskeletal pain associated with it. There has been, on a previous study on mice, some effect on the thyroid carcinomas. But certainly in every single surmount studies on humans, there has been no association with thyroid cancer. Right now, Mounjaro is not a weight loss medication. It has not been FDA approved for it. However, it is on fast track pace to obtain that FDA clearance. Currently, it's a diabetes medication. So, in summary, we really think that tirzepatide is a game changer to fight obesity as well as just weight loss in general. But obviously, you have to actually incorporate change in lifestyle as well. One of the things that patients have been asking is, what are some of the common side effects? So let's tackle on the most common side effect. Quite honestly, for most people, nothing. A lot of patients, they really don't feel any adverse reaction. The only thing that they feel is what's therapeutic, which is loss of appetite and early satiety. However, some patients do experience some nausea, diarrhea, or constipation, the GI symptoms. This is really dose dependent and how acclimated they are to the medication. And that's why it's so important that when we first start patients on tirzepatide, they start off in small dose. And that has significantly reduced the degree of nausea, constipation, or diarrhea. Some of the other reported side effects associated with tirzepatide are things such as higher heart rate, fatigue, sleepy as well. But quite honestly, like if we look at all of our patients, that type of complaint is extremely rare. And again, it has to do with slow incrementation of the dosage that we use. Tirzepatide comes in increments of 2.5 milligrams. So a lot of times we are starting patients off at 2.5 milligrams, or in some patients 5 milligrams. And we slowly increase that dosage by 2.5 milligrams. And what we have found is that has been extremely effective in controlling GI symptoms. One of the other questions that some patients have is, well, do I have to take this medication forever? Now that's true for diabetics, right? I mean, people with type 2 diabetes, they may be able to stop, especially if they can actually get their weight under control. But until that period of time, they have to keep on taking the medication almost indefinitely. However, for weight loss, that is still a question out there because there hasn't been a real large study that explores the weight loss and what the regimen should be. What we can tell you is that in our experience with our patients, they can stop and continue to sort of have that weight under control, or in some patients, even after they stop, they keep on losing weight. And we think that the reason why is they have early satiety, that even after eating a certain amount, they get full quicker than in the past, and they can't eat as much as they used to in the past. The other reason why we think this happens is that we continue to stress lifestyle changes even when they're on this medication. And it really is important to, number one, make sure that you eat the right type of food, well-balanced, small portions, maybe 2 or 3 meals per day. The other thing is obviously continue to exercise. Just can't avoid the fact that we need to continue to exercise to continue a certain amount of metabolic rate. Once that they actually get acclimated to doing this, that they continue to sort of do this out of habit. And even when they stop the medication, they continue to sort of be able to maintain that weight and not truly get a rebound effect. And so the rebound is extremely rare in our patients. Once they're on a therapeutic dose or a high dose, that we don't just stop the medication at that time. What we do is that just like how we initially start the medication, we start off slow, and then what we do is that we reach a certain plateau. Then if we're going to stop the medication, that we kind of taper it off. And we found that to be also extremely effective to avoid the rebound effect of weight gain. Overall, the patient satisfaction is extremely high. The effect is real, meaning a significant amount of weight loss with very few side effects. And done right, they continue to either lose weight or maintain that weight that they feel is ideal. In the past, when people wanted to lose weight, we talked about lifestyle changes, eating well and exercising well. And then we started supplementing that with a medication called phentermine, which increases metabolic rate and therefore they lose weight. Phentermine by itself stimulates maybe about 5 to 8% weight loss. And for a long time, phentermine with some other medications in combination has been really the mainstay treatment for weight loss. And then in 2014 is when the Saxenda came out. Once a day injection, GLP-1 agonist. What we noticed is that there was more weight loss than just phentermine. And that range was between 10 to 12% weight loss. Then for a long time, there hasn't been any real sort of advances until 2021. And that's when the semaglutide, initially it came out as the brand name was Ozempic for the treatment of type 2 diabetes. And then later on, it received FDA clearance for weight loss. And the brand was called Wegovy. Same medication, except the dosage is different. It's a once-a-week injection that targets the GLP-1 as well. And what we noticed with that was more weight loss than just once-a-day Saxenda. And that has been sort of the mainstay armamentarium that we had for weight loss. Then last year, Mounjaro came out. And Mounjaro is different than the previous classification because it targets two receptors, GLP-1 and GIP. And we think that this results in significantly more weight loss of 15 to 21%, which is a very significant difference. In practicality, what we have noticed is that in the past, we had patients on Wegovy, and a lot of them did lose weight. However, there were some patients in which there really wasn't a significant response. However, with Mounjaro, almost every single patient responds extremely well. And that's what we are really impressed by. And that really is the go-to medication now for weight loss patients. Over the last several years, there has been a class of medications that has come to the market for type 2 diabetes that also affects obesity and induces weight loss. And these are GLP-1 receptor agonists. Probably the most common and the most effective in the past has been Ozempic. The newer medication now, such as tirzepatide, or the brand name is called Mounjaro. This medication is different in that it affects at two receptor sites, the GLP-1, the glucagon-like peptide, or the other receptor that it affects is the glucose-dependent insulinotropic peptide, the GIP. And by affecting those two receptors, it seems to be synergistic and therefore more significant in terms of the efficacy. And so far, the studies have panned out that tirzepatide does seem to be more effective than Ozempic. And that has also been true in our experience at Wave Plastic Surgery on our patients as well. In the past, Ozempic was very useful in inducing weight loss. However, there were some patients that just didn't seem to actually see the result from the usage. However, with tirzepatide, it seems to be on a consistent basis. Almost everyone, they lose a significant amount of weight. And whether it's 5 or 10 pound weight loss, that's the target, or 50, 60, 70 pounds, it seems to be consistently effective. The way that it really induces weight loss is at multi-levels. Number one is decrease in appetite. Second, decreased gastric emptying. Third is early satiety. And it seems to work at the cellular level to induce more metabolism and therefore burn off more fat. Tirzepatide seems to work on almost everyone. And even after they're off of the tirzepatide, it seems to be continuously effective. And we think the reason why is that because the stomach domain has shrunk over the several months in which they've been on tirzepatide, that they still have that early satiety. And like most things, once patients starts losing weight, there is this momentum that they have and this positive sort of encouragement that they have. So that carries through in their diet and exercise regimen. If you like the contents of this video and you found it to be helpful, please hit the like button as well as subscribe to our channel.